It's now 6 months since Jo House and her partner Ash had COVID-19. But they haven't been able to return to work and still have symptoms.
I'm still struggling with quite a lot of shortness of breath, difficulty swallowing, really exhausting fatigue, a lot of brain fog, and pains in my muscles and my joints.
I'm not as bad as Jo, but brain fog, exhaustion's been the worst thing, just really only in the last month or so being able to do a couple of hours of something a day and then just getting really tired.
Jo used to love swimming, but has had to give that up.
Nobody really knows what's wrong with us, what to do with us. You know, people keep expecting us to get better and we don't.
The study found around 60,000 people could be living with long COVID in the UK. And researchers say long COVID may not be just one syndrome, but up to 4, including permanent organ damage, complications after intensive care, post-viral fatigue syndrome, and continuing COVID-19 symptoms.
If health professionals don't recognise 4 different syndromes, they might exclude people who are presenting with one that they know less about. So if they're expecting people to have this tiredness and fatigue, and people are presenting with somebody else, they may not recognise it.
Doctors at Southmead Hospital in Bristol are now analysing long COVID patients and say a joined-up approach is needed to treat them.
If we don't manage this properly, we may end up with a large number of people who have ongoing symptoms, who may be suffering for some time, who may be putting pressure on the health system, who may have much more importantly pressure on themselves. And we need to understand why that is to help this go away.
Jo says having long COVID is miserable.
You know, I feel sorry for a lot of people and there's a lot going on, but I really wouldn't wish this on anyone.
Everyone is feeling the impact of coronavirus, but those suffering the symptoms of long COVID say the worst part is not knowing when it will end. Layla Hayes, 5 News.